In 2021, there were more 911 overdose calls in BC than ever before. The Penticton Fire Department works in partnership with BC Ambulance when responding to high-risk medical emergencies. Last year, the team responded to over 1,300 medical calls, with overdoses being a part of that.
Certainly, the last 3-4 years, we've seen an increase in our overdose calls. The opioid crisis has been looming in our community for quite a few years now. We've seen a transition though from the user's point of view, where they are being more familiar with the drug, in particular fentanyl, and the impacts of that overdose, and how they're recovering from it using naloxone and being more aware of the drugs that they are using. And the recreational users that we were seeing overdoses with have certainly decreased, so they're more aware of the products on the street now.
Interior Health issued a drug alert on Thursday about a light green substance sold in Penticton that's caused a number of overdoses in the community. On Friday, the agency warned of a purple substance being offered in Kelowna that also holds a high risk of overdose.
You see certainly an impact on our medical emergencies, in particular overdose calls, when there's a highly toxic drug on the street. Those chronic users seem to have a pretty good understanding of their tolerances, but when a new product comes in that is more toxic than normal, then they don't necessarily know how to counteract that with the naloxone.
As awareness becomes more present, the fire chief has noticed that more users are making a conscious effort to use together and carry naloxone with them in case of an opioid overdose.
I think as we see the transition into the awareness of medical emergencies and overdose calls, we're hoping that the transition starts trending downwards, and if we see safer drugs, then we would likely see a lesser or reduced medical emergency for overdose calls.
For Gasnet News in Penticton, I'm Casey Richardson.